In this section, we are going to be taking a look at the concepts of social functioning. The objectives for this section are listed below. You can take a look at those. And the student learning outcomes that we will be concentrating are providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations guided by the Caritas philosophy. So demonstrating critical thinking and clinical reasoning when providing quality patient care in community-based settings. Being able to communicate effectively with patients, families, and members of the interprofessional team. And lastly, to practice as a competent nurse, assimilating professional, ethical, and legal guidelines. What makes an individual vulnerable? They are a person that is at greater risk for diseases, reduced lifespan due to a lack of resources, and exposure to more risk factors. We're going to be taking a look at, in this section, particularly individuals that live in poverty and are homeless. They are at significant risk of disease and a reduced lifespan. It is also, they have fewer choices and a greater number of disabling factors. Again, probably homeless and poverty individuals fit this the most significantly within this course. People are also vulnerable by financial circumstances, where they live, their education, their age. Children and older adults are more vulnerable because of their age, functional and developmental status, inability to communicate effectively. So patients that have English as a second language or no to little English ability are going to be considered vulnerable because of their inability to communicate and understand medical terminology in their condition.
You do need to have an understanding of the definition of poverty and the levels of income. In the United States, poverty is defined in terms of household income less than the identified threshold based on the number of persons in the household. This definition is based on monetary income before taxes and excludes capital gain and non-cash benefits such as food stamps, Medicaid, and housing stipends. The numbers listed are from the most recent federal poverty guidelines, and these numbers are used to determine eligibility of Medicaid and CHIP programs, which we'll be discussing during another class.
When we take a look at characteristics of homelessness, there are four main categories of individuals that experience homelessness. The fastest growing segment are families with children, and typically families become homeless as a result of some unforeseen financial crisis. There's a medical emergency, there's a death in the family, a job loss, and it's enough that maybe they were just living paycheck to paycheck, and now they lose their home, aren't able to pay rent or mortgage, and they no longer have a home. Youth is another category, and youth, it presents challenges in and of itself. It's usually due to family conflicts, divorce, neglect, or abuse, and they're runaway youth. So they typically have a harder time just because a lot of the financial supports as far as subsidized housing and rent do not actually start effect until the age of 18. So under the age of 18, they have very limited resources that are available to them. Another category are veterans, and usually war-related disabilities. It could be post-traumatic stress, mental anguish, and they end up on the street. And then there's a fourth category of chronic homelessness, and this is chronic is involving either long-term or repeated bouts of homelessness, and is usually coupled with some kind of physical or mental disability. There's several different health issues just to keep in mind that for people that are at risk or are homeless, they are more prone to upper respiratory disorders, tuberculosis, substance abuse and mental illness, also HIV and AIDS, twofold. One, if there is substance abuse and they are using needles, it's typically a shared needle. Or the second part of this is unprotected sexual activity. So they're at risk for STDs and HIV. Also, hypothermia and heat-related illnesses related to elements, not having shelter, and then malnutrition. And we're going to be taking a look at Maslow's hierarchy of needs in the next slide, and you'll see how somebody that is living in poverty or homeless, vulnerable patients, clients, they are not able to achieve a higher level of function. So strategies for prevention and assistance, knowing your places of support is going to be key. So I do want you to take a look at in your syllabus. It is listed, and then also on page 1635 of your textbook. There's a website, endhomelessness.org. Take a look at that. It will give you some more specific information as far as our particular area, and then also some strategies for helping to prevent and eliminate homelessness as well. But as far as a nursing standpoint and community health, you want to try to eliminate factors that contribute to homelessness, making referrals to mental health agencies for therapy and counseling, also alleviating existing homelessness by locating temporary shelters, meeting long-term shelter needs, and then also working with government officials to develop shelter programs is something a little bit more extensive. And then advocating and providing efforts to try to reduce the number of individuals that this is impacting. If you also take a look at Healthy People 2020, there are specific interventions and objectives related to decreasing the disparities that are in existence. And then having that nursing impact as well, making referrals for employee assistance and education programs that are going to help eliminate homelessness. Maslow stated that people are motivated to achieve certain needs, and he wanted to understand, and he believed that people possess a set of motivational systems unrelated to rewards or unconscious desires. So when one need is fulfilled, a person seeks to fulfill the next one, and so on up the triangle. One must satisfy lower level basic needs before progressing on to meet higher level growth needs. Once these needs have been reasonably satisfied, one may be able to reach the highest level called self-actualization. Every person is capable and has the desire to move up the hierarchy towards a level of self-actualization. Unfortunately, progress is often disrupted by failure to meet lower level needs. Life experiences, including divorce or loss of a job, may cause an individual to fluctuate between the levels of the hierarchy. So when you're taking a look at vulnerable patients, you need to take a look to see where they are at in this hierarchy of needs. And you will have to address the lower level needs before you can continue up towards that self-actualization. We will be doing an activity in class that will focus on Maslow's hierarchy of needs and putting together a teaching plan specific to the needs of the patient.